You want me to say that?
Okay, now it started.
Okay, now it started at the Auburn Medical Group. You are watching Dr. Mark Vaughan and Dr. Gawayne Vaughan. And
Who am I?
did I say Dr. Gawayne Vaughan?
You did. You stuttered on my last. It's the same as your last name. I just want to make sure you're aware of that.
Because we're partners.
Yes.
Okay, so let's go ahead and have our official announcement begin.
Well, good afternoon, and welcome to the.
Yes,
good afternoon, and welcome to the Auburn Medical Group YouTube broadcast, where we discuss health issues of which you, the participant, get to participate as a viewer. And here, like you said, it's Mark Vaughan and Dr. Gawayne Vaughan. And today's subject for you two guys will be opening on the subject of pediatrics.
Ooh,
gentlemen, good day to you.
Good day, Mr. Ed, and
Pleasure
thank
to be
you
here.
for the warm tones there, bringing us into the show. And thank you, Deborah Ronker, for the super chat before we even got
look at that.
started. What a way to get a start on the right foot. Okay, so the title is, Does Size Matter?
Wait, are we gonna?
Oh, brother.
What?
These guys. I hope you guys are
Well,
smarter.
I am like how much taller than you? 5 inches taller than you.
Hope you guys are smarter than most doctors. I had a doctor once that.
Do you know what it means if you have big shoes?
Uh-oh.
You
I
wear
don't-
big
wait a minute,
socks.
I don't. Anyway, I had a doctor once that gave me a prescription. He said that on the prescription label, it said take 2 pills on an empty stomach. That never worked because those pills just keep rolling off. Okay, well, gentlemen, let's go ahead.
Nice.
Thank you, Mr. Ed.
All right.
Always bringing value to the show.
Yeah.
Okay, so does
So
size matter?
what are we actually talking about?
Pediatrics is what
Not shoes.
Mr. Ed actually announced, that we are talking about pediatrics
Yeah.
when we say does size matter. The idea being that at the Auburn Medical Group, we take people of all sizes. Size doesn't matter, but yet it does. Because with the individual patient, you check some
That's
things.
right.
You actually check some measurements.
We do. Yeah. As kids are getting bigger, we watch them pretty closely.
Yeah.
To make sure they're growing appropriately.
Our thumbnail for the show today, it was one of those scales for height or length.
Yeah, the little measuring
You put the little
device.
babies on, put their feet at one end, head at the other.
Kind of cool. You can just put it right up against their feet with their head right on the
Yeah.
other side, and you
Yeah.
can see how big they are.
Can one person do that, or does it take one to kind of keep their legs straight?
Usually we have the parent kind of keep them straight because we want to
Okay.
get a good accurate measurement on that.
I thought maybe, yeah.
Yeah, they wiggle a lot. The
try to
little
move it
ones
up.
wiggle. You can't.
Okay. But you can see how tall they are.
Yeah.
How many inches in length they have.
Right. Yeah.
Or centimeters, depending on which reference you're using.
We always use centimeters.
Yeah.
I don't know.
We
More
do now?
precise. That's what I was trained in.
Okay. All right. So you were trained in the,
Yeah.
okay. the decimal-based system, which
Yep.
you can actually add and subtract from.
Yeah.
Yeah, it makes sense that the rest of the world uses. Okay, I'm good with that. and okay, who's from the Great Britain?
Bianca?
Bianca would be able to understand it if you talked in those terms.
Don't they do that in Canada too?
I don't
Do they
know.
do centimeters?
We'd have to ask. Who would we ask? Would it be
Teresia.
Teresia Rowatt? That's who we would
Yeah.
ask. She'd let us know.
Anyway.
We probably have some comments from some of those people already, I would guess.
Yeah. We already got some people saying hi.
Okay.
Suki, Lindsay Antoine.
Oh, Lindsay, sir, very good.
Yeah, thanks for showing up. Those are our channel members.
You too can be a channel member by clicking the little icon that says join.
Become a member?
Become a
join.
member?
Join. It is join.
Join. There we go. And also you have to hit the bell icon so that you get the notifications when we're live like this right now. And did you know that about 15,000 people get that notification when we tell them we're going to have a show?
Man, we are.
Yeah, I looked it up today to see how many people
Impacting a
how many
small
people actually
army.
have their phone set to allow notifications from YouTube. They have already enabled the bell icon. It's about 15,000. So
Yeah, you blew up my phone today. Just kidding.
did you totally unsubscribe?
Oh, man.
So yeah, if I don't see those numbers going down, then we'll go ahead and keep telling people when we go on the air.
Yeah. Hopefully you guys enjoy this content. So
Yeah. So let's
somebody
let
said I
Mr. Ed
have
do
a boat of a shoe.
a boat of a shoe. It probably costs more for those shoes. More
Actually,
material.
no. I mine are like at a size you can actually get. I mean, I wear a size. It depends what shoe, 13 or 14, depending on what what brand we get.
Wow. That's nearly twice my number.
Probably twice this price too.
Well, like you get good running shoes. Yeah, they're expensive.
So before we talk a little bit about those measurements and growth charts,
Sure.
Mr. Ed, is it
Suki from Minnesota.
Thank you.
Here's what I wanted to talk about last week. My grandson, who had
Pediatric
the
question.
lung issue, his mom had COVID when she was pregnant with him. Well, we
Young guy.
also found out that he has some nerve issues also with his case.
With it.
He has nerve issues. Okay.
I think it continues.
Does it?
Oh, yes, it does.
Oh, there's more. Okay.
With his left side. There we go. They talked to a pediatric neurologist and were told that, let's see, they are seeing more issues arise in infants where mom and COVID, who've had COVID
wow.
during 34 to 35 weeks pregnant, they will see him again tomorrow. So there are issues.
So this old COVID in pregnancy thing is a developing thing that we're learning about. Obviously, brand new brand new disease. So we don't know all of the implications of babies who are born to COVID positive mothers. I guess this is one of those things, and I truly couldn't tell you what's going on there because it's a developing area of medicine at this point.
Yeah.
But it sounds like he's really young. So if he was born while his mom had COVID, that means born within the past year, probably more recently. So he's a little guy. We're talking infancy, and those are very important years, or very important first 2 years, months, where a lot of development goes on. I mean, a baby goes from essentially, fully dependent, needing everything, to walking and talking and being a little human they're a little human, a little person at age 2.
They don't change
it's crazy.
species, really.
Yeah, well, no, just kidding.
But they do become
Some
more like
kids you
people,
may
yes.
wonder. Yeah. Oh, by the way, boom.
Oh, Lindsay. Oh, my goodness, Lindsay.
That's how happy she is to see me back. Oh, man.
It's
Warms
because
my
Dr.
heart.
Gawayne is back. That's where
I
it's
think
coming
that'll
from.
make him buy me some Dutch Brothers tomorrow.
Yeah,
Well, she says that Dr. Gawayne has a boat for a shoe.
Well, could be worse.
maybe the
They're
$25
skis.
is going to your boat license or something like
Skis.
that. So, yes, we need to have a production meeting with some Dutch Brothers. So
There we go.
we'll get around to that.
Perfect.
Yes. And we can cover COVID.
Yeah, as always,
Items in the
COVID
news
is
because
always in the news, so
that-
we are always trying to stay up on top of that.
We're putting out a daily COVID podcast, so
Yep.
we have information on that, and we do keep up on that. And actually, what's going on with Suki M's grandchild is not something we've caught yet because it's so new and so specialized. So thank you for sharing that.
Wow. Yeah, I'm sorry you're going through that, and
Yeah.
definitely
Yeah, I hope everything comes
have
up.
our thoughts
Gets
with
over
you.
it.
Yeah. So yeah, in those so the first 24 months, first 2 years are very important. Definitely an important part of a kid's life, and we actually see the child often in those first 2 years. So starting out right after they come out of the hospital, we want to get established, make sure everything's going well. They're gaining weight appropriately. If they have jaundice, that's common with kids. We want to make sure that they're getting over that. And then we see them essentially at 2 months, 4 months, 6 months, 9 months, 12 months, 15 months, 18 months, and then 2 years. So you see the child a lot within those first 2 years because there's so much change. And if anybody's had a child, you know the change that happens on almost a day-to-day basis in those first few months. Like every day they are learning and doing something new. So it's pretty amazing. So we're watching them pretty closely, making sure they're hitting all of those milestones. And the milestones come in a couple different types. So one is developmental milestones. Are they doing certain things, both gross, like big movements, and small, precise movements at the appropriate time? And then also size, like physical metrics. They should be following a growth curve based on where they start and just this kind of general trajectory. So yeah, a lot goes on, and it's very important that we see kids often in those first few months. And this is, I like seeing kids. It's one of the highlights of my day all the time. So that's a fun part.
Yeah. So we've been talking more about pediatrics, or trying to talk more about pediatrics to let it be known that pediatrics is part of family medicine.
It is.
You don't have to have a pediatrician for a healthy child who's coming in for well checks or has routine run-of-the-mill things that we take care of. And of course, if they were to have something that is not routine or run-of-the-mill, or we don't have it within our wheelhouse or is not something we're able to nail down, we can easily refer to the specialist of the appropriate area of medicine to take care of them.
Like a pediatric neurologist.
Yeah.
For example.
So you could have the whole family go to the same office.
Yeah, that's the benefit of having a family doctor. So I have families where I see the parent, sometimes I even see the grandparent, parent, and the child, which is just a really neat aspect of medicine. That is probably the main reason I went into family medicine, that you have these relationships with whole family units, and you get to see all of that developing. It's pretty neat.
We actually had, usually when you get the additional generations of a family, it's the younger ones that get added on. But we actually had the fourth generation going back to the older generation added on to our practice when somebody's grandparents moved into the area. And we've had 4 generations in that family. That just happened in the last couple of weeks.
Yeah.
In our practice. Cool. Yeah, we've had a number of generational families like that here in our practice over the last 16 years.
Yeah.
Which this is our first show since the Auburn Medical Group has been open for 16 years. So
that's right.
Happy anniversary.
16 years old. Oh,
yeah.
do we get a quinceañera?
Quinceañera?
Yeah.
That's 15.
That's 15.
Thank you.
Missed it.
That was the last
Do we get a sweet
year.
16?
Get a special
Hey, there you
dress
go.
with lots
Sweet
of frills.
16. Sweet 16. That's the one I was trying to think
Sweet
of.
16 and never been kissed?
Well,
I'm not sure how to apply.
by a patient?
I've lost
I can't say no. No, I think I'm pretty sure.
Oh,
I
you
have.
lost your...
I've lost
okay.
my...
So speaking of being kissed by patients,
boy.
I have had... I love my little old ladies, and they love me. And sometimes they will just get makeup on my white lab coat.
I have seen that.
You've seen it.
I have seen you wiping off the makeup.
It's completely innocent, though. Let me tell you, it's completely innocent. Okay, let's go back. Wait a minute. Do we know about both of these?
We only know about one of them, so we need to call out that other one.
Laura Burzik from Chicago, I think, says, always happy to see both of you. Can't leave out Dr. Vaughan. Love these chats. I think she's talking about you when she says,
Him,
Here you go, Mr. Ed.
me, him.
So,
me.
A bit of a competition there between Lindsay Antoine and
Hey,
Laura
all right.
Burzik, which
Thank you.
We are fine with that. You can fight over us. That's we will not stop you. Okay.
Yep.
So, all the family, the first 2 years we're talking about size. But it's not just pediatrics where size is an issue that we pay attention to, making sure they're hitting those milestones.
Sure.
At the other extreme of age, we also try to encourage people to not have their pills roll off.
Make sure they have a flat abdomen. Or those pills just stay there.
We do look at body mass index.
We do.
Which is a ratio of weight to surface area, supposedly, but the surface area is estimated by a person's height. It's not perfect. I did have a patient who had a BMI over 25. This was a young person in her 30s, and said, I don't believe in BMI. When I told her BMI was a little bit over 25.
Believe.
So then I looked at the situation and
Like
realized
it's a deity?
this is the deity of BMI.
I don't know when we're talking about beliefs.
This is a person who can get away with saying that because she was actually a very muscular person.
Oh, okay.
In a line of work that's very physical, has to stay fit, does lots of training for it. And it made sense to me. Yeah, she actually was a very lean person with a BMI a little bit over 25, and I could not bring myself to say, "Oh, you need to
lose weight."
Weight.
And so it's not a one size fits all.
I said, "You can say that
metric."
Most people who say I don't believe in BMI, you can just look at them and just say, "No, you are fat," and we need to do something about it. I don't know if I ever, Mr. Ed, do I ever say it that way?
Not to me. I haven't said it to me at all. Say it to my wife, maybe.
Oh, man.
I'm not. You do your own dirty work.
Oh, man.
Okay.
We got some people here that
watching.
are making comments.
Okay.
Suki once again. I think she's from Minnesota. Is that it?
I believe so.
she says that her granddaughter and grandson have the same pediatrician that their daughter did.
Oh,
Excellent.
How about that?
And the daughter's now 25, so
Oh, that's
now the
neat.
daughter's
We like
25.
hearing that.
Yeah,
And
that's
then
great.
Connie, when I was growing up, my family saw the same doctor all the time.
Yeah.
So
Yep.
Yeah, lots of times.
Yep.
It's a close relationship. People don't like to switch. In fact, I just had a patient last week. He lives in Cameron Park.
Really?
And I looked at him, I said, you can't find a doctor closer than Auburn?
Yeah, I know.
But he just expressed, it's not you.
Yeah.
Well, I appreciate
I
that.
have some
Thank you.
patients that-
I appreciate that.
Many that are down in like Roseville, Rockland area that travel up here to see us.
There was a patient for a period who I had who lived in Monterey and
Wow.
drove, I think, 3.5 hours, maybe even
At least,
4.
yeah, about 4.
Wow.
And had family in Grass Valley. I said, oh, so you're visiting family in Grass Valley? No, I came up
No,
to my doctor's
just for-
appointment and
just to
turning
see
around
you.
and going back now. Had to have an afternoon appointment to get here in time.
Gosh.
And
It's like a whole day affair to see the doctor.
wow.
I think I currently have one
honored.
in Walnut Creek. That's probably my
Walnut
farthest one.
Creek drives
Yeah.
all the way up from Walnut Creek. So
Yeah.
gee, that's a good 70 to 90 minute drive.
Yeah.
Even with good
that's
traffic.
That's the
So-
one that comes to mind for me. I think that's
Wow.
probably my farthest away.
So it's surprising. And then we'll have people who will move to Lincoln and say, oh, yeah, we're moving to Lincoln, so we're going to find a doctor down there. Okay.
How long has it been since
I'm
you
moving to South Auburn. Sorry.
How long has it been since you were at Sierra Doctors?
How long? It's been 16 years now.
16.
That's right.
And how long were
Well-
you there?
I was there
Or
for
Sweet 16.
3 years.
So it's not quite 20, but we've been going to you all that time. And if we move to Monterey, we'll continue.
Wow. What an endorsement.
If Mr. Ed moved on Monterey.
Mr.
Thank you,
Ed.
Mr. Ed. I appreciate that.
What an endorsement.
Yeah. And I was going to say, you had family in Monterey at one point.
Well, yeah, the daughter was going to college down there, so.
Yeah.
And I had worked there for a while myself.
Oh, I didn't know that. Okay.
Oh. Yeah.
Mr. Ed has a background in broadcasting, in case you didn't notice. So that's radio.
They wouldn't,
You got
they wouldn't have guessed it yet.
you got a face for YouTube audio.
What'd you say? A face for YouTube?
I got a face for radio. Nobody has to look at it. Connie Bassesi, our doctor was around the corner from our house.
Oh, that's nice. When you can just watch.
Gee.
I think we have some patients that.
We do.
Well, we got a lot that are up. We have a what's it called?
What's it
Older
called?
folks community.
Oh, we have lots of those.
Yeah, they're literally a block away.
Most of them don't walk, though,
Yeah,
who live there.
yeah.
But we do have patients who walk to the doctor's office.
We do.
Auburn Greens is really close. We have patients there who
I've
walk
had patients
over.
walk from there.
We have one patient who shouldn't walk alone from there. who,
Coming up. Why
and
not?
Christina gave a ride home.
Oh yes, yeah. We've had that.
Yeah.
Yep.
So I'd be curious to know if any of our patients are commenting, given that we're talking so much about our patients in our practice. But
Yeah.
it's such an international audience that
Right.
there's people all over the place. The chance of them being from Auburn is actually small.
Probably.
It's actually for the comments. It's not usually from people in Auburn.
Right. I know some of them who comment after the fact or tell me,
Yeah,
me, oh, I saw your video the other
Yeah,
day.
they'll tell us. Or actually, what I've been getting a lot is when they saw me on the news.
Oh, yeah, yeah.
The news from Sacramento. They saw that.
Famous.
Other comments or questions about the
Well, I'm
size
going to
matters?
let Gawayne read this next one
Is
down
that
here
bad? He has to read
from
it?
Lindsay Antwine.
From Lindsay.
I don't know Mr. Ed, but I like him.
Oh,
Look
we
at
go.
that.
there we go.
Lindsay, you like Lindsay. Yeah, no, Lindsay.
Lindsay, thank you. That'll only be, I only paid you $25 to say that.
That's right. Good. We're glad you like Mr. Ed being a part
Yeah,
of it.
yeah. And hope we're trying a new format. I like this. I think
Yeah.
we got some good
Yeah.
engagement
So,
here.
size matters. Let's get back to that. We were talking about BMI. What are the things that we do when a patient does have a high BMI? So BMI normal is like 22 to 25, that range.
18 to 25.
18, oh, wow, it goes down that low. I didn't know that.
Yep.
And then without a reference, I know it when I'm in the room because I got the reference right there. Just don't have it memorized. 30 and above is considered obese.
Right. So
And,
25 to 30 overweight, 30 and above obese.
and there's,
They have different severities. Of
I was
them.
going to say there's a severity above obese.
Right now, when I document it, I basically just say severe obesity, and then it actually has where you can document for the new ICD-10 coding guidelines. It actually, have you seen that where you can say with BMI
Put the
40 to
exact
45
number. Or a range.
Yeah. Unfortunately, I think my record is a 70. BMI of 70.
What?
Yeah, that was a long time ago. Patient who was hospitalized when in my residency. Yeah. So
into residence. I was going to
Yeah.
say I've never seen that around here because a person would be wider than they are tall.
she yeah.
Wow.
That would be a good description probably.
Oh my goodness.
Yeah.
Or nearly
Yeah,
so.
It was.
I exaggerate for effect. For dramatic effect.
It was yeah. So your BMI should not be over what your ideal weight should be in kilograms.
No, and that person's was. Wow, that's incredible. Okay.
Yeah.
So what do we do when somebody's BMI is high?
Well,
Except for that patient who I said, okay, you can get away with it. And she was barely over anyway.
Yeah. Well, if it is something that, we always talk about diet and exercise. This is, to a T, every patient who is overweight or obese should be adhering to. Now, a healthy diet, we're not talking about those fad diets, nothing that's going to, get you down 30 pounds and then you're going to gain it back in a month. That's not what we're talking about. We're talking about a nice, sustainable diet. And that typically includes smaller portions, number one, very important, and even calorie counting for some people. I do advise some people to do that sometimes, at least to get a good idea, because some people have no idea how many calories are in what they're eating. So it's good to know what that is, and there are amazing apps that you can use to guide you for that you can even put in, this is my weight, this is the weight I want to be, and it'll tell you how many calories.
I think MyFitnessPal.
Yeah, MyFitnessPal is a good one for that, but so that takes time. And then besides fewer calories, it's healthy calories. So we're talking fruits and vegetables primarily. It should be mostly a plant-based diet, and then your proteins should be nice lean proteins or even plant-based proteins. Beans, legumes are very healthy. So if we talk about a plate, we talk about this percentage. So at least half of what you're taking in should be fruits and vegetables. A quarter should be a lean protein. And then the other quarter should be a complex carbohydrate. So that's not talking about sweets like ice cream or candies or snacky foods. That's talking whole wheat grains and that sort of thing. So that is a good place to start. Why don't you talk about exercise a little bit?
So with exercise, we like to have people get approximately 150 minutes of some kind of activity in on a weekly basis where they're getting their heart rate up to what we call the target zone. In general, and you really should get this cleared with your primary care doctor before you start a program with this, and you should start gradually. But in general, that target rate is going to be around 80% of your maximum heart rate, which there's a general formula for figuring that out, 220 minus your age. And then you do about 80% of that. I know that's a lot of math, and you can find this online too. There's calculators that will do it for you. So you can put in target heart rate calculator, online target heart rate calculator, do a search for that. Again, about 80%. And if you can do that for, say, 30 minutes a day, 5 days a week, or if you like to get it all out of the way at once and your schedule works better for that, say 50 minutes a day, 3 days a week, that will be getting you most of the way there to really, really good cardiovascular fitness. When I say most of the way there, an Olympic athlete is probably only like a quarter better than that point. It's really getting you a lot of the benefit of a person in very good physical condition if you can get that much time in. And to do that will have your heart getting the exercise it needs to stay healthy and a lot of your systems related to it.
Yeah. And sometimes we can consider surgery. It's not always that we do that, but that is an option in some people. Now, I must say that surgery is not the easy way out. That's actually the hard way out because it does come with a lot of restrictions after that surgery, and you do need to hit some certain metrics beforehand to show that you can stick with it after the surgery. So it's not the easy way.
Yeah, there are people that bariatric surgery is better than what they're currently doing as far as yo-yo diets or just not able to get the weight off and the health risks they have. But it itself is concerning. There are risks. And people will say, well, why would a doctor recommend such a drastic, dangerous thing? The reason is because the state the person's in who's doing it is in such a bad place to start with as far as the risks for their health. that it's worth doing. And this is people with very high BMIs who are just unable to lose weight through anything else they've tried up to that point.
Yep.
We don't do that many of them. In fact, we have some people who have had it done, but I can't think of anybody right now.
I actually just saw one of my patients who has had it done.
And how are they doing?
She's doing well.
Okay.
Yeah.
So some do really well, but the ones that stand out are the
She's
ones that
young
get
and
the weight
otherwise
back.
healthy. So
Okay.
yeah.
I have two who, after having their bariatric surgery, the weight came back.
That does happen
And
sometimes.
that
yeah.
really makes it hard to recommend it to all those people who would do well with it and
Yeah.
would keep it
Right.
off when you see that. And then I have had people who do a little bit of the yo-yo thing even after bariatric surgery, that they'll start to gain weight and they'll realize, oh, wow, I'm going back to what I was doing before, and then have to do things to make changes in their life to go back to eating the small portions. And
Right.
But it's
Yeah,
hard.
and for some people, if they don't have the ability on their own to do it, there are weight loss doctors, medical weight loss doctors, who actually will sometimes prescribe a certain diet. A lot of them are proprietary, and you have to pay a lot for them. But that can be helpful for some people to have a little bit of help there from a physician.
Yeah, in general, I don't like the meal replacement or the protein shakes or whatever the products are, but yeah, there are people where that would be appropriate to do. I don't do it myself. We don't have it
No, we
through our
don't either.
office. We refer to somebody that gives it more attention and is studied for that.
Yep.
Before we wrap up, Mr. Ed, did you have any final...
Well, Suki from Minnesota comes back and makes a great comment. She says, the trust between a patient and a doctor is much like husband and wife. I trust my doctor, he says, because the first thing he did say was, if I can't find out, I'll look for it. And I'm not God. So,
Humility, that's a good thing to have in a doctor,
Yes,
for sure.
Yes, we don't know everything, and we do have to look it up and sometimes have to refer. And we do have patients with a number of things going wrong with people, even though we know most of what we're dealing with. There are the occasional patient where we and the specialists don't find the thing. And it's our job at that point is to help them living with this unknown.
Yeah.
And it does happen.
It does.
Often enough that it comes to mind.
Yeah.
Okay. So
Very good.
should we let Mr. Ed take us out?
gentlemen, thank you for another enlightening half hour with medical issues. A program where you, the viewer, get involved. Auburn Medical Group is located in Auburn, California. If you're ever here, drop by. Please tell a friend or a relative and join us again next week. Is our subject going to be anything special?
It'll be very special. It'll be timely. That's why we can't tell you what it is. We can't tell you what it is.
It's so timely because we figure it out.
And we do have people we have to thank.
Yeah, absolutely. So yeah, over at Patreon, I do have a Patreon I'd like to thank. Teresia Rowatt, thank you for what you do. I do want to say, hey, go check out drgreenknight.com.
Yes.
It is kind of applicable to what we talked about today. I wrote a little bit on how to choose between a pediatrician or a family physician for your child. So check it out, or send that to somebody who needs to make that decision.
And I'd like to thank Lindsay Antwine, and throughout my socials, they're all at Dr. Vaughan. And
Mine
until
aren't because he
next-
took them. Go on.
His isn't, because I took it. I was a doctor for how many years before he was? I grabbed it while I could. Until next time,
Hey, I'm Dr. Gawayne Vaughan.
Mr. Ed.
Goodbye, everybody. See you
and
next week.
Dr. Mark Vaughan telling you to stay in good